here and try to take out a little bit more right here.
Right.
Now, you could ask, well, why didn't you do that at the first operation? Well, anytime that I get further onto this area, there's a chance that I could make damage to the pancreas, damage to the bowel that wouldn't be able to be healed. So we go, if you didn't have PSC, to be honest with you, we cut it actually way up here. We just cut it up high and we leave that bile duct and we use it. For PSC patients, we generally take it low, but we don't, unless we know there's a cancer, we don't try to dig into there, because I would hate to surgically hurt things such that I had to do the Whipple operation, because I could get to the point where I'm forced to do a Whipple operation, and I wouldn't want to do that if you didn't need it.
Whipple operation is where
That's the taking out the pancreas. Yes, that's the big operation where we would take all of this out. So that would be the
And you wouldn't know until you got in there.
We wouldn't know until we got in there.
Oh, Jesus.
So we could, if you said, I want you to try to take out this little bit, I'm happy to take it to the operating room and try to take it out. What I would want to know from you is, if I got to the point where I couldn't safely take any more out, do you want me to proceed to the Whipple operation, or do you want me to stop and close you up? And then you would be exposed to a whole operation that we did nothing for, potentially, if we're not ready to go.
I
to
think
Whipple.
just surveilling it, and that's it. Just keep an eye on it, get some scans
And
every few months.
Right, I think early on, we do maybe a scan early to get a baseline, and then probably yearly after that is enough if things are going well. I do want to get an answer back from the endoscopist. That's the one person I haven't heard from, is the Rochester endoscopist. If they have any thoughts or anything they might be able to offer to that we couldn't offer here in Florida. They just do more endoscopy up there, so it may be that they're
However,
more common.
if we did nothing,
Yes,
he could develop pancreatic cancer, couldn't he?
bile duct cancer, but yes. Slightly different than pancreas cancer, but it would be like the cholangiocarcinoma or bile duct cancer.
Which is the very thing PSC patients
Can get.
And they're saying, oh, if you get that, then we give you exception points.
Yes.
That's a whole other thing.
Yes.
So we caught it just sort of before that, I guess.
Yes. If you had not gotten a transplant, you likely would have eventually developed a cholangiocarcinoma.
Yeah.
I don't know what the answer for how long eventually is, but eventually you would have developed a cholangiocarcinoma. And that's probably true of anyone that has PSC, but you are, say, closer than somebody else that doesn't have high-grade dysplasia.
Right.
Is there anything he can eat or anything to clear it out or any of that?
No, there isn't. I wish we knew of that. I always tell people being healthy, eating healthy helps for your overall health, but for cancer prevention, no. Like I say, Dr. Gores thinks that taking the bile out of the picture makes it less likely to progress to cancer. So the situation that you have now where there's no bile going through it means that it's less likely to progress to cancer, is what his thought is.
If there's nothing going through it, it's just
dedicated his life to researching the disease. I trust his opinion, but again, it's still in the research
So
stages.
he's saying don't do anything?
He's saying do the surveillance.
Do the surveillance, meaning just watch
CTs,
it.
Yeah, CT scans.
So it's sort of like precancerous dysplasia, but that doesn't necessarily lead to cancer.
Correct. It's not like this is, the first stage and it's absolutely going to become cancer. No, it's precancerous.
Okay.
It could progress to cancer, but at this point it's not cancer. If I had gotten this, so if we had known about this, say we had known about it beforehand, that what would we have potentially done differently? I would have tried to take out more tissue. I probably would not have gone to the point of a Whipple operation at the time of your transplant, meaning I would not have taken all of this out, because we've done a number of studies that patients that have that big operation don't do well after the transplant. So we would have potentially there's a chance I could have gotten a little more out here, but I probably would have not proceeded to the Whipple operation, because the leak potential is so high, and then you do poorly with your transplant, and it's safer to get you through the transplant safely.